Miss Kurosawa has had her vital signs checked. They're all within normal range. She has had her height and weight assessed. They're in normal range as well. Upon entering, I assessed her gait. It was within normal range. She is alert and oriented, and I'm ready to begin. Hi, Miss Kurosawa. My name is Mercedes Harbert. Today I'll be your student nurse. Could you provide me with your name and date of birth, please?
Misono Kurosawa, February 7th, 1992.
Okay, can I check your armband? Okay, and today I will be performing a head-to-toe physical assessment on you. I'm going to try to keep it under 30 minutes, so I'm going to begin by washing my hands and providing us with some privacy. Okay? I'm going to start by checking your skin, and the skin is warm and dry. Your skin color is consistent with genetic background. I'm going to assess your skin turgor. And it shows elasticity, which means you're drinking adequate amounts of water. So now I'm going to begin my assessment by palpating your head. And before I do that, your head is normal cephalic. So I'm going to palpate your head and scalp. And I don't feel any lumps or abrasions, which is good. Now could you puff out your cheeks for me? Could you smile for me? Could you frown for me? Okay, cranial nerve number 7 is intact, and I will perform a light sensitivity test on you. Could you close your eyes for me, please? Tell me when you feel it. Say now when you feel.
Okay. Now.
Okay, cranial nerve number 5 is intact. Could you clench your teeth together for me? And hold against my resistance. Okay, cranial nerve number 5 is intact. Next, I'm going to palpate your temporal mandibular joint. Could you open and close your mouth for me, please? Okay, I don't feel any popping or crepitation, which is good. Okay, next I will assess your nose and mouth. Could you meet me at this end of the examination table, please? Okay, could you tilt your head back for me? Okay, and I'm going to tilt your nostrils up. Okay, mucosa is red and smooth. Turbinates are red and smooth, and I don't know any deviation within your septum. Okay. Could you close your eyes for me, please? Could you close one nostril for me at a time and sniff and tell me what you smell?
Alcohol.
Okay, now the other.
Alcohol.
Okay, cranial nerve number 1 is intact. Okay, next I will assess your mouth. Okay, could you open your mouth for me, please? Okay, I note the hard palate, it is pink and moist. I note the soft palate is pink and moist and intact. I note the buccal mucosa, it is pink and moist and intact. I note the Stenson stuff. Could you lift your tongue for me, please? I note the frenulum and Wharton stuff. They're pink and moist and intact. Could you put your tongue down for me, please? I note the posterior pharynx and tonsils. I would give those a 1+. They're intact and pink and moist. Okay. Could you stick your tongue out for me, please? Okay, I'm going to depress the tongue. Could you say ah for me? Uvula and soft palate rose midline. And now I'm going to check your gag reflex. Okay. Cranial nerve number 7 is intact. And could you close your eyes for me, please? Stick your tongue out and tell me what you taste.
Sugar.
Okay, cranial nerve number 7 is intact. Okay, could you open your mouth for me one more time? Okay, I note 28 dentition with no dental caries. Okay, next I'm going to assess your neck. I know that the trachea is midline. I'm going to name and palpate your lymph nodes. Pre-auricular, posterior auricular, occipital, submental, submandibular, superior cervical, no, jugular, digastric, superficial cervical, deep cervical chain, posterior cervical, and subclavicular. Okay, now I'm going to get behind you and I'm going to palpate your thyroid gland. Could you lean forward to me and to the right? Okay, and to the left? Okay, your thyroid gland was not palpable, which is a common finding. Okay. Now could you shrug your shoulders against my resistance? And could you turn your head against my resistance? Okay, cranial nerve number 11 is intact. Okay. Oh, and when I did your mouth assessment and checked your gag reflex and if your uvula rose midline, I noted that your cranial nerve 9 and 10 were both intact. Okay, so now I will begin the assessment on your ears. I'm going to start by palpating your auricle, your tragus, and your mastoid process. Did you feel any pain or tenderness?
No.
Okay, that's good. Okay. I'm going to do an internal exam of the ear. Okay. Can you turn your head for me, please? I'm going to pull the pinea up and back. And I do see the tympanic membrane. It is pearly gray, and the cone of light is in the 5 o'clock position. I know the umbo, the manubrium, and the malleus. I'm going to inspect the other ear. And I note that the tympanic membrane is pearly gray. The cone of light is in the 7 o'clock position. I note the umbo, manubrium, and malleus. Okay. Next, I'm going to assess your hearing. I'm going to get behind you. I want you to close one ear and repeat after me what you hear.
Okay. 1, 2, 3.
Okay. Now could you close the other ear for me?
ABC.
Okay, and that shows that your cranial nerve number 2 is intact. And now I will perform 2 tests on you. First, the Weber test. I'm going to stimulate the tuning fork, and I want you to tell me when you no longer hear the sound.
Okay. I count here.
Okay, now I'm going to do the Renee test. I'm going to first put it on your mastoid process and then directly outside your external ear, and I want you to tell me when you stop hearing.
I count here. I count here.
Okay, and your air conduction was greater than your bone conduction, and that is within normal range, so that is good. And these 2 tests show that cranial nerves number 2 and 3 are both intact. So now I'm going to begin your eye exam, and I'm going to note that both eyeballs are symmetric, eyebrows are symmetric, eyelids are smooth and symmetric. Okay. And I'm going to begin by testing your vision with a confrontation test. Okay. Could you put this eye in front of, could you put that in front of the eye opposite mine? And I want you to tell me when you see my hand.
Okay. No. 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 No.
Okay, and with the other eye?
No. 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 No.
Okay, that's good. Next, I will assess your visual acuity with the Snelling chart. Could you put your glasses on for me?
Oh, yes.
Okay, I want you to read to me the smallest line that you can see and close your right eye.
Okay. 374258.
Okay, and for that you got 20/30, which means in your left eye you see what a person with normal vision would see. You see at 20 feet what a person with normal vision would see at 30 feet. Could you close your left eye for me and read the smallest line?
374258.
Okay, you got 20/30 as well, which means that you see at 20 feet what a person with normal vision would see at 30 feet. Okay, now I want you, could you remove your glasses, please? Could you please gaze past me? Okay, now focus in on my finger. Okay, and I saw symmetric constriction of both pupils. Could you gaze past me again? Okay, and I note that there is a reflection of light equally symmetrical in both pupils, so that's good. And now I need you to follow my pen light. Okay, that's good. Those tests indicate that cranial nerves 3, 4, and 6 are all intact. So now I'm going to carry out the examination of the optical fundus.
The renal artery first, and then the iliac artery. Alright, we are good to go there. Alright, now.
Okay, I'm going to come in at 15 degrees. Gaze past me, please.
Now what we're going to do is light palpations. Actually, first. I start with the right lower quadrant. I'll go to the right upper quadrant.
Okay.
Left upper quadrant. Left lower quadrant. Alright. Tympanic sound.
Okay, I note your red reflex. I note that the optic disc is a creamy yellow, and I see paired artery and veins. Okay, I note your red reflex. I see that the optic disc is a creamy yellow, and I note paired arteries and veins. Okay, next I'm going to assess your pulmonary, and I'm going to start by assessing your lung sounds. Okay, could you breathe through your mouth for me, please? Okay, and I do not hear any crackling, which would indicate good airflow. And during the assessment of your neck, I forgot to palpate and auscultate your carotid arteries. So I'm going to do that now.
Now your feet, if you could you go down and up and side to side. Okay, good. These have full range of motion and the feet.
Okay, and I would give that a 2+ equally bilaterally. Now I will auscultate your carotid arteries and switch my stethoscope to the bell. Okay, I did not hear any bruits or swooshing, which is good. Next, I'm going to auscultate your heart sounds. And I'll have to go underneath your shirt for this.
Okay.
Good. That's 2+. Now we're going to relax your leg. We're going to do the feet.
The aortic, which is in the second intercostal space on the right. Pulmonic, which is in the second intercostal space on the left. The mitral, which is in the fifth intercostal space on the right. And the tricuspid, which is in the fifth intercostal space on the left. Okay, and with auscultation, I was able to hear normal heart sounds. I didn't hear any murmurs. I heard a lub-dub, which are S1 and S2 sounds. S1 is heard at the apex, and S2 is best heard at the base. That's good. Next, I will assess your capillary refill. Could you give me your finger, please? Capillary refill was within 3 seconds, so that's normal. Next, I will assess your pulses. So I'm going to start with your brachial. And I was able to palpate equally bilaterally, 2+. Your radial. Which is equally bilaterally. Your dorsalis pedis.
Could you move your shoes for me, please?
Which is a 2+ equally bilaterally. And your posterior pedis, which is a 2+ equally bilaterally. Okay, now I am going to move on to the chest examination. I'm going to start behind you. And I'm going, when you feel my arms around you, I'm going to ask you to take a deep breath in here. I'm looking for symmetric movement.
Okay.
Okay. Deep breath. Okay. And I did note the symmetry. Now, when you feel my hands on you, I need you to say 99 for me, please.
Okay. 99, 99, 99, 99.
Okay. And I was checking for tactile firmitas with that. And next, I'm going to percuss for resonance and dullness. Okay, and resonance and dullness were noted in the appropriate places. Okay, now I'm going to assess for your CVA. I'm going to do this test on you to check your kidneys, and you shouldn't feel any pain, just pressure. So let me know if you feel any pain, okay?
Okay. No pain.
that's good. Now I'm going to assess your abdomen. Could you lay down for me, please, and lift your shirt or something? Okay. I'm going to begin by auscultating your 4 bowel quadrants. I'm going to start with the right lower quadrant. The right upper. The left upper. And the left lower. Okay, and bowel sounds were heard in all 4 quadrants. So now I'm going to assess your vesicular sounds, and I'm going to switch to the bell part of the stethoscope. The aortic. The renal. The iliac. And the femoral. Okay, and I did not hear any bruits or swishing, so that is good. Now I'm going to palpate your aortic artery and note for any vibration. Okay, there are none. Now I'm going to assess your abdomen. It is flat, the umbilicus is inverted, the skin color is consistent with genetic background. I don't see any inflammation or hernias, so that's good. I'm going to start with my light palpation. Do you feel any pain or tenderness?
No.
Now I'm going to do my deep palpation. Do you feel any pain or tenderness?
No.
Okay. Now I'm going to try to palpate for your kidney, which is palpable, and your spleen, which is not palpable. This is common. Typically, the kidney is only palpable if it is enlarged 3 times its normal size. So that's good. Now I'm going to percuss your abdomen for tympany and dullness. Dullness should be heard over organs, and tympany would be heard where there aren't. And I noted the change in pitch. Okay. And that would end your abdominal assessment. So now I'm going to move on to your musculoskeleton. Could you lower your shirt and sit up for me, please? Could you hold your arms up like this for me? And now I'm going to test your muscle strength, and I need you to resist me pulling and pushing against you. Okay. Okay, and you have equal muscle strength in both your upper and lower extremities, so that's good. Now I will assess your deep tendon reflexes. Could you extend your bicep for me, please? your patella. And your Achilles. Okay. Okay, now I am going to assess your neurologic function. Could you say light tight dynamite for me, please?
Light tight dynamite.
Okay, that indicates that cranial nerve number 8 is intact. And when I assessed your ears for the whisper test, that indicated that cranial nerve number 8 was intact. Okay. Could you stand up for me, please? You can put your shoes on.
Oh, that's okay.
Okay. I want you to perform the tandem test, and that's walking heel to toe about 3 or 4 steps. Okay. That's good. Now I need you to perform the Romberg test. Close your eyes for me and just try to stand still. Okay, there was very little swaying, so that's good. And could you raise one leg for me, please? Okay, that's good. Now I need you to press each finger to your thumb. Start off slowly and then speed up. Okay, and these tests assessed for coordination and balance, which are all seem intact and good. And now I will assess your range of motion. So could you place your head to your chest for me? I'm sorry. And then up, and then back, and then to the right, and to the left. Okay. Could you raise your right arm outward over your head, and then back down to your sides, and then out and into a big circle. And do the same with your left, above your head, down to the side, back up and into a big circle. Okay, now could you lift your knees for me, please? And then back down, and with your other leg, please. And then back down. And now I will test the range of motion for your feet. So could you extend forward, and then back, and then inversion, and then eversion. The same with the other. Forward, and then back, and then inversion, and then eversion. Okay, it seems that you have good range of motion with all of your joints. And at this point in my physical examination, I'm going to go over my notes to see if I've forgotten anything, so you can have a seat on the examination table. I forgot to test your face for light sensation. Oh no, I didn't. I did test that one. I forgot to assess your spine in range of motion. So could you stand up for me, please? And bend over. Okay. You can sit up. And I noted that there was no popping or crepitation when I assessed the other parts of your range of motion. So now I am going to, you can have a seat on the examination table. Now I am going to place an object in your hand with your eyes closed, and I need you to tell me what it is.
Okay. It's a key.
Okay, good. And I'm going to draw a number in your hand, and I need you to tell me what number it is.
Okay. 7.
Yes. Okay, and this will conclude my full head to toe return assessment. Thank you so much for being a good patient.
Thank you very much.